Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's quickly glance through the anatomy and the PYQs of the year 2024. So in case of factual questions, we'll just be discussing the answer. In case of something to understand, we'll be dealing in detail. So the first one being the absence of the gag reflex. So this absence of the gag reflex results from the injury of the nerve, that is 9 and 10. So 9 is the glossopharyngeal and the 10 is the vagus. Now moving on to the second one. If a tumor compresses the structures passing through the opening of the given image. So in the given image, there is the superior orbital fissure which is marked. So superior orbital fissure, and which of the following sensation would be affected? So in case of this compression of the structure, the sensation of among the given options, the answer is the sensation of in the anterior scalp and the dorsum of the nose. So this is what is lost, as it will affect the frontal nerve and the nasociliary nerve. Why is it so? Because the two nerves which are involved are the frontal nerve as well as the nasociliary nerve. Next, moving on to the next question, we see a tobacco consumer. So the question goes by: a tobacco consumer goes to a dental clinic, and this is because of the patient has they have bleeding gums as well, and on diagnosis it's a carcinoma of the tongue. And which of the following papillae do not have? So which of the following papillae has no taste buds? So which of the following papillae has no taste buds and is least likely to be involved in the cancer? So the answer here is the filiform. So among the given options, the filiform is they are the minute structures. They have no taste buds. They can be cylindrical, they can be conical as well, and the projection is mainly present in the dorsal part of the anterior two-third. So they're present in the dorsal part of the anterior two-third of the tongue. The filiform papillae do not contain any taste buds, and they are covered by the KSSE, that is a keratinized stratified squamous epithelium. Next, moving on to the next, there is an artery which is used for the arteriovenous. So artery which is used for the arteriovenous shunting of the great saphenous vein for the hemodialysis. And is located behind the medial malleolus. So this is nothing but behind the that is a medial malleolus, and 2.5 centimeters in front of the dentocalcaneus. So 2.5 centimeters in front of the tendocalcaneus. So what is the answer here? The answer is nothing but the posterior tibial artery. The posterior tibial artery. Next, moving on, there is a image. So this image is nothing but of the omphalocele. So this omphalocele is nothing but, let's just describe what is an omphalocele. It is nothing but a midline abdominal wall defect. So it is a midline abdominal wall defect, and where the bowel and the solid organs, it protrudes through the umbilicus. So it protrudes through the umbilicus, and the umbilical cord, it inserts directly into the sac. So here the outer covering of this condition is nothing but the presence of amnion. Next, moving on, there can be cadaveric images as well. So there is an identification of the medial pectoral nerve. So let's roughly draw a diagram. So the thoracoacromial artery was mentioned, then the lateral cord, Next, the images mentioned, it included the axillary artery, the medial cord as well, medial cord, and the other image which was asked is nothing but the medial pectoral nerve. Next, moving on. A patient presents with the sciatica. So the patient, it presents with sciatica, and also there is tenderness. So sciatica as well as tenderness, and this is nothing but in presence of in the hamstring muscles. And which of the following nerves it supplies the hybrid muscle that is likely to be spared with the condition? So here the muscle which is involved is nothing but the adductor magnus. So a patient presented with the sciatica as well as the tenderness in the hamstring muscles, which nerve supplies the hybrid muscle that is likely to be spared in the condition? So the hybrid muscle which is likely to be spared in the condition is adductor magnus. So which nerve supplies this? The answer is nothing but it is the obturator nerve that supplies the adductor magnus. Next, moving on, there is an image of the transitional epithelium. So there is a transitional epithelium. So we need to know to identify the transitional epithelium and which of the conditions it is seen. So the transitional epithelium, that is a urothelium, it is seen in the ureter. So this is an easy question. It is seen in the ureter. Next is, which of the following during an examination of the patient, the teacher asks the patient to convert, or the professor asks the teacher to convert patient to invert the foot and points to a prominent tendon located behind the medial malleolus. So on inversion of foot and points to a prominent tendon. So you have a prominent tendon which is present on the behind medial malleolus, behind the medial malleolus. So what is this tendon which is highlighted, which is prominent? So the answer is it is the tibialis posterior. Next, moving on to the next question. So an elderly patient or has difficulty in buttoning the shirt, so unable to button the shirt. The next one is there is an increased clumsiness in the daily activities as well, and unable to make an OK sign. So these are the keywords. OK sign is not possible, and OK shape by opposing the thumb and the index finger. Which of the following muscles is likely to be involved? So there are various options given, and on seeing this question, the mainly what are involved, it will be the flexor pollicis longus as well as the flexor digitorum profundus. So these two are nothing but it is the branches of the median nerve, that is the AIN, supplied by the AIN, which is a branch of the median nerve. So in the options, these two are not given. So the best possible answer will be the abductor pollicis brevis. So abductor pollicis brevis is uniquely and consistently innervated by the recurrent branch of the median nerve. So the best answers in the options is the abductor pollicis brevis. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.